Their life has to be affected in either one or two or maybe all of the domains, and for a specific number of months or weeks at least. Once skipping a friend's get together or something does not equivalent to social anxiety. So forcing somebody to go and meet people, come out of the room, that's never going to help. Help the people take their time. Try and reduce their anxiety. Just instructing them and say, let's reduce the anxiety is the last thing to do.
I'm not doing very well today. I want to skip the party. I don't feel comfortable going around when there's so many people. I think I'm more comfortable just going around with my friend. These statements might be familiar. You must have seen people around you using these statements because social anxiety is not so easy to live with. You must have seen people around talking about, does it come under the category of personality type, or is it a disorder that needs to be addressed by a mental health professional? So, before stepping into finding solutions of social anxiety, today we have with us Dr. Medhavi Sood, who's going to help us understand what social anxiety actually is and how we can manage it. Welcome to the space. Welcome to the conversation, Dr. Medhavi.
Thank you so much.
So, I think before going ahead, let's give our viewers a little brief about who Dr. Medhavi is. Because since we have invited her here to talk about social anxiety, she is a practicing clinical psychologist. She has completed her PsyD in specialization in clinical psychology, and she's currently working in her private practice. So I think maybe we can begin with something that I made part of my introduction, which is, people have a very general notion of introverts don't like socializing with people a lot. How do we differentiate that personality type from a clinical condition that we use the term sometimes loosely as that this person has anxiety? So from a clinical perspective, we'd want to know how the two of them are different.
Right. Okay. So I'll put it very simply, actually.
Yeah.
So there can be two or three types of people that you probably see. One is somebody who's very social, who tends to go out with people, has a lot of friends, tend to be a little more chatty, so to speak, or for that matter, have a lot of friends. Those people are called extroverts, right?
Right.
Then there are people who are called introverts. These people will prefer to probably stay alone or have only a limited number of people they interact with, or for that matter, prefer to stay in a very quiet place, speak very less. If spoken to, maybe just a few words or just a word or so here and there. Those are introverts. When we start talking about a clinical condition, the only thing that needs to be noted over there is if it has started to affect one, your personal life, two, your professional life,
Mhm.
three, your social life, and four, your daily activities. If
Right.
it's affecting any
Oh,
one or all, then it's a clinical condition that's going to require a mental health professional, qualified mental health professional to help you out with it. It's as simple as that.
right. So you mentioned about affecting, these functional areas of your life, whether it's personal, professional, occupational. So what are the prominent symptoms or what are the prominent signs that we can pick up with people around us or somebody that's around, probably sometimes this goes missing or we don't identify. From your perspective, clinically, what are those signs that we can pick up on to categorize and we tell that, this person needs help or we take the initiative to take them to a mental health professional?
Right. So when I start talking about, say, clinical aspect of it, then you'll pick up signs from these four areas itself.
Right,
When
right.
it comes to, let's say, we start from work.
Hmm.
So you'll see that these people will probably prefer to do work one on one, like maybe how right now you and me are talking. If
Right.
it was a meeting, say maybe three people, four people, 10 people in the meeting, that probably one keep their videos off,
Hmm.
mics off. If somebody's directly talking to them, it'll take them a while to open the mic if it's an online meeting. If
Right.
we're talking about in-person thing, they'll prefer to remain alone in a cabin, They'll speak to the boss directly and not other people. They'll prefer to eat their lunches or breakfast or whatever based on however their work is going alone. Right? Even if they are talking to somebody, there'll be very specific number of people. They'll speak less.
Right.
They'll just keep to themselves. In Hindi, you tend to say अपने काम से काम रखना
Yes.
और फालतू और चीजें नहीं करना. That is your work related sign, right? Then we come to the social aspect. When we start talking about social aspect, you'll see one that they'll have lesser number of friends, right? They will have, say, maybe a few people who they find to be their confidant, if so to speak, right? They will also speak less. You'll find maybe a line or two. The conversation that probably you and I are having, which have a lengthier answer,
Yeah.
you'll see them maybe saying just a single line, a word here and there, just monosyllables as we usually speak, right? All of those things. That becomes your social life. They'll prefer not to go to social gatherings. They'll prefer not to even go to work related meetings. They will prefer not to, let's say there is a presentation at the office that is supposed to be done. They'll make the presentation. They won't say no to work specifically, but they will hesitate when it comes to actually presenting the presentation is concerned. They will be very scared of even public speaking of any kind.
Yes.
If it is a clinical condition that we're talking about, then you will most likely not see them heading a position. So top level managers, top level directors, top level people, you will usually see that these positions are where there is a lot of public related dealing, right? Your managers will have employees under them. Your directors will have like whole companies or something, a team running under them or something of that sort. So these people are inherently, those positions will ask for more extrovert people who can talk properly. Their communication will be better, right? But on the other hand, the people having social anxiety, which is clinical in nature, those people may not even go up to that level. If they are there somehow, then they will prefer not to speak to the team, right? There is a basic level of a fear of being in some sense judged by other people. So
Right.
even if they are, say, forced to attend a meeting, they will constantly keep telling, let's say Urvashi today has forced me to come to this meeting. I will probably constantly keep saying, Urvashi, I think somebody's going to judge me. Is there a way to avoid this? Can we do this online? Can I please keep my camera off in some sense?
Yeah.
Is there any way we can avoid this? You will tend to hear things like this, right? That's your work related. Similar things you will hear even in their social life. They will, one, have very limited number of friends. They will prefer not to go out with those friends. They will prefer to stay cozy maybe at home, not even interact with people. If they are living with somebody, right, they will prefer to stay shut in their house, right? That becomes your social life. When I talk about daily activities or basic needs for their own selves, they will, yeah. So in those conditions, you will see that these people will, one, if they need help of any kind, let's say they want help for a physical injury only, they're going to hesitate for that as well, right? They will start having things like palpitations, sweating, right? They will start having a fear so much that they will stop going out altogether, going out of their rooms or going out of their houses. Usually, when we talk about social anxiety, it might be also accompanied with things called as, say, agoraphobia, or things, it will be accompanied by, say, maybe a panic attack, which is all again clinical in nature, where
Right.
you will see that if I have to go out of the house, I'll start having anxiety. It's going to be so severe and so overwhelming that it's going to prevent me from even stepping outside either my house or my room also,
Yes.
right? So they will always prefer to sit in one place. So it's not as simple as not wanting to meet your friends on a today basis. Their life has to be affected in either one or two or maybe all of the domains, and for a specific number of months or weeks at least. Once skipping a friend's get together or something does not equivalent to social anxiety.
So we talked about symptomatology, or we talked about identification in terms of symptoms. Let's understand a little about the management of it. So if I'm identifying someone around me, I'm sensing. So how can I support, or probably what kind of support or what kind of strategies can be effective in managing it by ourselves? We surely, I mean, mental health professional is the right way of going about it. But according to you, what are the best measures that we can take from our end?
So if I would say that, let's say there is a person X
Hmm.
who identified a person Y as somebody is having social anxiety. So one thing primarily that I as a professional tend to tell everyone around me, if somebody is coming to you with anxiety,
Right.
one, hiding something from them, two, forcing them to do something will only increase the anxiety. It's not going to solve the anxiety,
Yes.
right? So forcing somebody to go and meet people, come out of the room, that's never going to help.
Hmm.
Help the people take their time, try and reduce their anxiety. Just instructing them and say, let's reduce the anxiety is the last thing to do,
Hmm.
right? So if you or a person X is trying to help somebody out in maybe using some strategy or something, help them in understanding, one, that there is a difficulty. Two, help them in understanding that the difficulty has been going on for a while,
Right.
that you as an outsider has noticed that these things are a little away from normal,
Hmm.
that that person is suffering through all of these things in all the domains of their life, right? Also help them understand that requiring help is also not a bad thing. It's going to help them only get better, help them reduce that anxiety in some sense. That becomes your primary step.
This is very helpful to understand, because I think people use sometimes these terms very loosely, or anybody who's willing not to participate in a group gathering, people use, why are you being socially so anxious, or this person is experiencing social
Right.
anxiety. It's important. So I think I'd like to conclude the conversation with a message that you'd want to give as a clinical psychologist to our viewers and listeners, is something that be more sensitive, or whether it's anything when we're talking about social anxiety. Any message from your end that you'd like to give?
Right. So I think the primary message that I would want to give is, one, please stop using these terms loosely.
Hmm.
Right.
Yeah.
Everybody is going through some or the other difficulty in their life. That does not equivalent them as having a disorder,
Hmm.
right?
Yeah.
Everybody is struggling with some or the other difficulty. So let people take their time. So one, please stop using these terms so lightly, right? Secondly, if somebody does have some difficulty,
Right.
let them take their time and help them understand and seek the help that is available out there. So that is the most essential part. And thirdly, of course, please don't discriminate. Somebody has some difficulty,
Yes.
right? So discriminating them or labeling them with something or a diagnosis that probably people use so loosely, that's only going to increase their problem. It's not helping them. So if
Yes.
you can't help somebody, at least try and not increase their
Make it
problems,
worse.
right? Yeah.
Yes. Okay, so this sounds incredible. I think it was a very insightful session and conversation with you, Dr. Medhavi. And I think on this note, we'll conclude our conversation for today. Thank you so much for taking our time for this conversation.
Thank you so much for having me.